Okay, and we are now recording. So, Colleen, if you wouldn't mind getting us started.
Well, welcome to our first MCADSV membership Zoom conference call. I'm Colleen Coble with your coalition, and what an extraordinary time that we are in. And I am so grateful to all of you that you are extraordinary people who every day show that in your work that is now being really tested in new ways. It is our hope that we can stay connected as a community to offer support and to share information and to stay connected when there is so much that is unknown right now. But you all have as your expertise the work of navigating new ways through crisis, of comforting people, of bringing others together, and of being all in all extraordinary when the times call for it. That is certainly where we are today. So what we've put together is, I hope, an opportunity for us to learn from each other, as we always have and as we always will. What's working, what's not working, a way that you found through. And then we will continue as the coalition to provide regular opportunities for all of us to stay connected. We really think that doing these calls along with staying in communication on the various Basecamp online platforms that we have will augment our ability to stay connected. The coalition office is closed. We are all working remotely though. You can reach us by email, by Basecamp, and by phone. We have the ability to connect by phone that's being forwarded. So we're grateful to you. We will rely on you, and we will respond as best we can to make sure that we have every chance to share good news together, to make it through the difficult times, and to continue to be in community as we always have been.
All right, thank you, Colleen. And Zach, if you wouldn't mind unmuting yourself and giving a quick update from your end.
Hello, everyone. I just wanted to give a quick update in regards to funding. Just talking to a lot of the major funders out there to see where they are with their response. So we have heard from the federal offices that they are working remotely. So that will maintain services. So the grants payment request system will remain open. So that means they'll continue to be able to draw down funds and disperse funds. For folks that have federal grants that may be closing out, they're going to be looking at grant extensions that are coming out of there. And also anybody that may be writing RFPs, there's going to be some due date changes. Basically, they're extending things. So that list will be out and we will share that. I've talked with our state departments, mainly Department of Public Safety and Department of Social Services. They both are planning to maintain operations and continue to be able to process invoices. That they said they would continue to contact us if anything changes on that. DSS is in a meeting today around several other issues that I'm about to talk about. So there hopefully is going to be another update from them today. There was guidance that was issued at the federal level that allowed some flexibility in how grants are administered and how they can cover costs. Federal language is giving people the necessary flexibility to have administrative leave, to have extended sick leave, also to change how you provide your services, whether you have to go to telehealth style services, but just kind of a change in that. So we've reached out to both DPS and DSS and DHSS to make sure that they are in agreement with that. That's come out from the feds, and so hopefully we'll have that guidance. There will likely have to be some policy updates that you do on your end to make this allowable within your own organization, but we will also be sending things out via Basecamp that will assist you with that. So those are the two big things that we're waiting to hear back from them around current grant administration. We have also put in a request with DSS about opening up VOCA dollars for emergency funding. So our current request for this is to cover costs like hotels, additional supplies, other things that you may have to do that's outside of your current grant. Now, VOCA, your current grant funds will cover these activities. So if you need to have hotel coverage, you can do that. That's allowable, always is. But what we're trying to do is get additional funding since that most likely isn't in everyone's budgets. So when I get updates on that, I will be sending things out via Basecamp and through our different messaging channels. And then, of course, if you have questions, feel free to email me and I will be responsive. Thanks, everybody.
Thank you, Zach. So I did want to give one other quick mention, and it's actually to Laura Zond and Zach, because they had mentioned to me the call that they had with the membership committee on Friday as we kind of began this conversation. And I just want to give a quick acknowledgement, much as Colleen did, that we are figuring this out as we go, and we are working on all of this together. And so even with the best laid plans that we have all had for times like these, we are very much working on it as we move along. And the way that we might have to structure our organization or provide services, some of the decisions we have to make might not feel comfortable or great for us right now. But again, we are all in this together, figuring out as we go along. We are your coalition, and so we are working to respond to your needs. And we are also encouraging all of us to support one another and lift each other up when and where we can. And so in that spirit, I do want to go ahead and get us started with our panel. And so the first person we have is Marianne Allen, who is the Executive Director of Haven House in Poplar Bluff. Marianne, can you unmute your line?
Well, we hope so. Did I do it?
You got it.
Yeah. It's always a crapshoot with me, you know. Hi, everybody. I'm just going to take a few minutes to say a couple of things about your local public health department, because I think my esteemed colleagues have way more information that you all are going to need about our day-to-day work that we're doing. I'm particularly interested in this and overwhelmed by it. I have been on the local public health board for 22 years. I've been the president for the last several, and we recently lost our administrator, so our hair is on fire. But that being said, I do want to remind everybody that this is not a time to panic. This is a time to think thoughtfully and be careful. Think about not only the people we serve, but the people who work with us and what's best for them so that we can meet our mission. Right now, the governor wants your local health department to be your go-to people for information for your community. They think communities are their own best experts here about what they need to do. So the internet's great, but you need to be looking at real solid, true information about what we need to keep everybody safe. So the public health departments are the ones who are going to be in charge of the testing. All the health professionals will report to your local health department how many tests have been given and how many are positive and negative. Right now in Missouri, we've had 215 tests. Only 8 of those are positive. They are in St. Louis, Springfield, and Henry County. No more have been turned in. We do know that. We also know, as most of you do by now, that this is going to be from droplets that can travel 6 feet. So thinking about that's important too. Fever is your biggest thing. Something I just learned in an emergency meeting a while ago that I had missed is that only use Tylenol. Do not use ibuprofen. Okay? It's the only thing that's going to help. But, and all the health departments are really encouraging us to not be going to the hospital or the doctor unless we really have the symptoms that you're going to find on the CDC website. Keep those visits down so that the people who really need to be there and they can treat them, and call your doctor before you go. But like I said, your local health department is your expert. They're the ones who are going to be giving guidance there. They are meeting daily with your emergency management agency, which is meeting with FEMA, and you know how that goes. And so they're the ones that are going to be doling out the most current and correct information. If you need help figuring out how to do something, they're there to help you. Don't delay if you need to talk to them, because they are going to be your experts.
All right, thank you, Marianne. And I appreciate you starting us out with that perspective. I know that you've been working with your local public health department for quite a while, and it's, I think, a testament to just how important it is that programs reach out to their health department, work alongside them, especially in these times of crisis. So I appreciate you getting us started with that.
We work with them all the time. We need to continue to do that during this pandemic.
Absolutely. Thank you, Marianne. I'm now going to turn it over to Julie Donnellan. Julie is the president and CEO of MOXA in Kansas City. Julie, are you able to unmute your line?
I am here. Can you hear me?
Yes, I can. Thank you.
And I apologize that my video isn't working. I can't figure it out. I can do the rear video camera, but not the front one. So not sure what's going on. But anyway, I'm happy to be here. We are actually, like you all, working remotely. Starting yesterday afternoon, we closed the office and began working remotely. And I'm sorry, you were wanting me to talk about?
I was hoping that you might be able to talk a bit about your hospital advocacy program and how you all are working with area hospitals as well.
Sure. So Victoria Pickering, who is our director of advocacy, had contacted last week our local hospitals, and at that time we were getting a little bit different information from each hospital that we contacted, because we have about 20 hospitals in the Kansas City metro area that we respond to. St. Luke's actually was the one who told us that they recommended that we no longer provide in-person hospital advocacy. So at that point, knowing that the situation was going to get worse before it got better, we just transitioned all of our hospitals to online advocacy, or to telephone advocacy. So we communicated with all the same programs within the hospitals or the coordinators that we worked with, and let them know of our intention. They all, Victoria did a great job working with them to make sure that they had all of the process and procedures in place to make sure that they had access to our staff and our advocates. It very much is working the same way that we activations would for in-person, except that instead of actually going there, we will use the telephone to talk with them and to provide advocacy. The nurses all have consent for follow-up forms with them, as well as our assault survivor kit bags that have a change of clothes, toiletries, information about MOXA services in that bag. So the staff at the hospitals have that, have those bags, as well as the consent forms, so that we can also do follow-up once the survivor leaves the hospital. And then in addition to that, we are also providing all of our services by phone right now. So all follow-up services are being done by phone, whether that's advocacy. We're also moving to supporting our counseling clients by phone when that's appropriate.
And Julie, with the hospital advocacy and dropping off the bags and consent forms, do you have one designated staff person or volunteer doing that? How did y'all kind of coordinate that handoff?
So that was done primarily by staff, because it was during the week. So on Friday, Victoria and the other advocates took all of those bags out and the consent forms to the area hospitals. So it was done primarily by staff. I believe Victoria was still making some deliveries over the weekend as well.
Okay. And then another quick follow-up. You had mentioned that you all are really providing services over the phone now and remotely. Is there any sort of specific equipment or program that you all are using for that?
No, we're just using the telephone. Our client database is web-based, so counselors have access to that. We do have VPNs available for staff on laptops. Luckily, most of our staff had laptops already, so they were able to transition to working from home relatively easily. We have had to buy some additional, or we will have to buy some additional cell phones. And the way we're handling that is because most of them are going to be for counselors. We will likely do prepaid short-term phones for their use because we don't anticipate, knock on wood, that this will go on past hopefully 3 months. And so we don't want to incur the cost of an ongoing telephone contract, a yearly contract for those phones. So we're just going to do temporary phones for now.
Okay, excellent. Thank you, Julie. Any other kind of tips or thoughts about moving services to be remote?
It was interesting that you mentioned the policy today, because what we recognized is that based on people's job duties, they may or may not have enough activities to fill their timesheet. So while we may, tell people work from home, work as much as you can, when they're filling out their timesheets for the government grants, there will likely be gaps of time that they aren't able to work. So what we have done is implemented a public health and safety leave policy that would provide paid leave for those times, those gaps in time when they can't be working, whether that's because they don't have enough work, whether it's because their job doesn't allow it. So for example, our receptionist, there's some that they can do from home, but not a lot. Or if they have young children at home and they don't have daycare and they need to be home with those children. So we've implemented a policy to address that, to allow for paid leave in those situations.
Okay, that is a really important consideration. I appreciate you bringing that up as well, Julie.
I think some of the other considerations are confidentiality. So we also had, before this, anybody who had VPN or access on their laptop to work remotely, we have a VPN or technology policy around confidentiality that everybody signs off on to make sure that they're in a private room, a private setting where other individuals can't see names, can't see information, can't hear what individuals are talking about. And I think that will be some of the challenges, and it'll be interesting. And I think this is one of those learning moments. We'll have a lot of opportunity to figure out how to continue this and how to move forward. I think it's just going to be some trial and error, because I know a lot of our folks are home with children. And so how do you support clients? How do you provide advocacy? How do you do those things if you also have children at home?
Yeah, absolutely. And those are some of the things that we've also been looking at and researching and then putting into the resource sheets that we provided out on Basecamp as well, because I agree with you, Julie. I think it's really important to consider, if we are working remotely, how does that impact the work we're able to do from home, especially if we have children or other family members that we are caretakers for, and just being really cognizant of that as well. Any other tips, Julie?
The only other tip I have is to be super flexible and grateful for, I'm grateful for our talented staff and their desire to support survivors while they are feeling heightened anxiety at the same time personally. So I appreciate the work that everybody's doing. I also appreciate that for those for most of the programs, you all have shelters. And so that just creates another additional things that we don't have to think about at MOPSA since we don't have the shelter. So thank you all for maintaining those services for survivors at this critical time.
Thank you, Julie. I do see a couple of questions coming in, and I've been keeping notes on all of those. So once we are able to make it through our entire panel, I will go back to the very first one and then start addressing them. So I did want to let people know, I see your questions coming in, and we will absolutely get to them. I'm now going to turn it over to Allison, who's the director of Lafayette House in Joplin. Allison, are you able to unmute?
I'm unmuted.
All right, thank you, Allison.
Thank you. And I'd like to introduce Teddy Brown. She's actually our clinical director and probably does a lot more of the hands-on. And if there's specific questions, she can speak to that as well. So I also want to just start by saying thank you. What we are doing is really hard. And I don't know if I'm any measure. I've done it a long time, but this is overwhelming. And some mornings you get up and it takes your breath away and you feel like I have a fire hose pointed at my inbox right now. I'm getting so much information from so many sources and a lot of it is conflicting. So really trying to weed through that and make sure that what we're doing is in conformance with best practices as our federal partners and our state partners are telling us is tricky sometimes. So lean on each other. I'm glad you're doing this. I think we just really need to provide each other a lot of support because this is hard. So Joplin had a major tornado in 2011, and that was very apocalyptic. And I think we learned a lot during those days. Of course, to be honest, that was very small by comparison to this because it was very contained. But
Allison, I don't mean to cut you off, but I did get a message in the chat to ask if you could speak up just a little bit.
Sure, and maybe I can turn my volume up a little. Is that better?
Yes.
Okay.
Thank you.
So really using the lessons learned from our tornado, the number one piece is be flexible and communicate with your team as much as possible. So the very first words out of my mouth to my management team is, let's come up with a plan for today. And everybody that we talk to about this plan needs to know that this is a very fluid time and that we will continue to adjust and modify and change the plan as time moves forward, because it is a fluid situation and the problems are going to change day by day. We looked at now I do a lot of things in teams, so I'm always going to talk about we because we approach our work as a team. But we really looked at two things: our responsibility to the people that we serve and making sure that they are safe. We provide a lot more services than what are critical for keeping people safe. And to be honest, those other services fall off the priority list. So our number one responsibility right now is to make sure that the women that we're serving are safe and that we're going to keep them that way. If we can't staff our facility, if we don't have the people to run a shelter, then no one is safe. So the number one thing we have to do is make sure we're prioritizing what we're doing and that we're protecting our staff. So those two pieces just run together with us. I'm going to look at my list because Monday we really nailed down a lot of pieces. We are going to try and send staff home. And the first thing we did as managers is ask all of our staff if they self-identify as at risk, because those are the people we need to get out of the shelter. We need to figure out how they work remotely. We wanted to know what resources they have available to them. So if we give them a laptop, do they have the Wi-Fi in order to run the laptop? So those two questions. The third is just really your willingness to be flexible with your own work schedule. So do you have children who are now out of school and you have to figure out how to take care of them? And would you like to work some alternate hours or partial hours so that you're helping meet the service needs, but also meeting your family needs simultaneously? We really have a commitment that anyone who needs to work, who doesn't have enough paid time off, we're in this for the long haul. No one on my staff has PTO until August. I mean, it's just not there. I can't pay PTO to my team until August. So helping people preserve their time off is important to me. So one of our managers, for example, she immediately has a child who's out of school and she's working half days. So we're trying that this week. She's started in the morning, she works until noon. So that preserves a lot of her time off. And then she's working from home on things that she can, when she can, but she does have a child to care for. So again, just flexibility, making sure that the staff, that you are honoring the staff and engaging them in the process. So rather than just say everybody goes home or you go home, we're trying to figure out what best meets the employees' needs. We have 2 residential units that we are shrinking down to 1 right now. And that is because of the employee drain. I do not believe that so Joplin doesn't have any active coronavirus that we know of, at least as of this morning, in our community. But once it ramps up, we know that people are going to be sick. And we have to be able to plan for how we maintain shelter throughout that. And shelter is the one piece that if you're not safe, we have to offer. So we're going to condense into 1 shelter. We are establishing isolation rooms within this single shelter because we know that our hospital is not going, they're not going to provide care for people who are positive with the coronavirus, but not in medical crisis. So where do those people go? Once we've got them diagnosed as positive with the coronavirus, we can't just integrate them back into shelter like nothing's happened or we've reinfected everybody else. So we're setting up, initially we picked 1 room and we were creating like a living area within a bedroom so we could isolate someone. Now we're looking at having 3 of those spaces in this new revised 1 shelter that have their own designated bathroom. But anyway, a way for us to isolate them but still care for them and still make sure that they're safe. We are looking at, we canceled group services for now because of the need for social distancing. So we are looking at re-implementing that using Zoom once we get all the, we're kind of stuck in administrative protocols on that right now. We're gathering information from our clients, how they can access Zoom, for example. And we need a permission, we need a release, them telling us that it's okay to participate. And we don't even know where to find such a thing. We're trying to make something up right now that says that they understand what that is and that they're giving their permission to participate, even though they would be signing in. We just want something documented that they understand what that is. We do have our security system. We're going to be giving all the staff laptops so that they have our VPN and that all of our security is in place. We did purchase a Zoom subscription today that's as a healthcare clinic, which does layer on some additional privacy and security measures for the Zoom conference so that our client confidentiality would be protected. So we're kind of weeding through all of that right now. We're hoping by next Monday to have some of that actually rolling out as far as the surface. But right now we're communicating with the clients, gathering information about how many of them have access to what, to a cell phone, to a laptop, to a tablet. We have eliminated all visitors on campus. So if Children's Division, for example, was used to coming on campus, we're trying to do all that via conference call now, not having any visitors on campus. We did suspend all outside meetings for staff. We're not approving any meetings or trainings where they go off-site. Can you jump in, Debbie? Anything I forgot that's critical?
No, I just think we're really working hard to educate the staff and the clients on how to be safe and precautions to take. And, I think that there are some that maybe not be as much up to speed as others. So we're really just trying to help everyone understand how to be safe and how to keep themselves safe and keep their families safe and the importance of that here so that we do have staff who are here to be able to help take care of the clients that are staying with us.
And we did tell staff that if they choose to travel, a lot of people had spring break plans, that if they choose to travel out of the area on spring break, that they would have to self-quarantine for 2 weeks after they return so that we know that they're not returning with the virus. We are making sure that any job that has already been identified as critical, that we have at least 2 people who are able to perform that job. And we're trying to do some separation with those people as well so that maybe they don't work exactly the same schedules. Budget impact. So this is tremendous budget impact for all of this. And our CFO is home working and doing the budget impact this afternoon. I do want to mention, so is Zach, are you still there? I did want you to know that the Department of Mental Health reached out to us last week, and they are holding all their vendors financially harmless. So they said that, so they're working with us to get a lot of the Medicaid or Medicare rules changed, but they've told us that they're going to do gap funding like they did for Joplin during the tornado in 11. And the worst that we can do is what 1/12 of our contract allocation would be. So they have pretty much assured us an ongoing operating fund for our substance use services. So boy, that sure would be sweet to hear from DSS. Just saying. I think that's it, Matthew.
Thank you both very much. And I really appreciate you talking about a lot of the internal decision-making and planning that you all have gone through, not only around staffing and budget, but also really thinking about the travel and well-being of your staff there. And if people do have to travel, how are you self-quarantining to keep everybody else in the program safe as well? So I appreciate you really talking through all of those details.
Great.
And now I am going to turn it over to Jessica, who is the Executive Director of St. Martha's Hall in St. Louis. Jessica, can you unmute?
I think I am. Can everyone hear me? Great.
Yes.
Okay, so I will start by saying that until I was on a Zoom meeting, I didn't realize how much I was touching my face, and now everybody can see me touching my face when I'm not supposed to. So I will at least hold myself accountable to that. I will begin by saying that I have no idea if what we're doing right now is going to be considered best practice. A month from now, we might all be shaking our heads and wondering why we did what we did. But I can at least say everything we're doing is well informed at this point. About 10 years ago, we had to develop a pandemic plan for COA, and we all laughed because it seemed absolutely ridiculous, some of the stuff we were writing down on paper. But that plan at least gave us a really great framework to start operating from in the last several weeks. So I will say that probably I'm sort of taking the perspective of if and when this happens again, what have we learned? So ago,
Jessica, I think that you might be cutting in and out just a little bit.
Do what?
Oh, now you're back. Your computer froze,
Oh, okay.
and so I think we missed maybe the last 30 seconds of anything you said.
I'm going to move a little closer. I don't know quite the rhyme or reason here, but let me grab my notes. So we work in a shelter. We're used to having germs. We're used to always having something going around. But about a month ago, we started making sure we had hand sanitizer. We started handing it out to every resident, started talking a little bit more about universal precautions in our house meeting. And that's sort of how we continued until we had our first confirmed case in St. Louis County. And then we became a little bit more formal about our meeting. We had our first confirmation on March 8th. On March 9th, we had an internal safety committee, reviewed our very ancient pandemic plan line by line, and made adjustments based on what we knew about this particular virus. We sort of, looking back, would probably consider it pre-pandemic at that point, but we're able to start putting some things in place. Catholic Charities USA had shared with us a community pandemic readiness checklist. So we started reviewing that. As early as March 9th, we officially started attending virtual meetings whenever we could. We put a ban on all volunteers. And on March 9th, we had officially closed one of our rooms to be considered a quarantine room. It's not the best because we still share the same ventilation, but it's the best we can do in a shelter setting. That particular room does have its own bathroom, so we are really able to limit. We sort of looked at it like any good safety plan that we're all used to doing. We are simply trying to minimize the risk as much as possible at this point. On March 10th is when the official pandemic was announced. And for about 12 hours, we put a hold on everything we were doing. We knew we needed more information to make informed decisions. That was sort of the first, I will say, smack in the face that I realized about communication. We were full, so we would not have been able to do an intake anyway. But in less than an hour, there was a rumor circulating around St. Louis that St. Martha's had closed up shop because of the coronavirus. So that is not at all what happened, but I also know people operated out of fear. So we had to clean that up a little bit. We also at that time asked women who were not working and who didn't have to leave the shelter to really restrict their movements until we could figure out what this meant. So that night we talked to everybody we know. I happen to have a really good friend who works in infectious disease, so she was very helpful. What she told us at that point was that more so than residents, of course, we're worried about minimizing their risk, but that a pandemic doesn't usually just last for a few days. And once it's declared, there's certain criteria that have to be met before it can be canceled. And that it was going to be really important to keep staff as healthy as possible, as long as possible, if we were still going to be able to offer services on a long-term basis. So at that point is sort of when we came up with the plan that we've been practicing since then. We have a daily cleaning checklist for each staff. So for each shift. So each shift has a long list of things that must be done at the beginning, at the end of each of their shifts. And that's signed off on. If it's not signed off on, we have to assume that it wasn't done and somebody's getting stuck doing it twice. So we closed the dining room. We are still providing the meals, but we're bringing them up. So we are sort of on a multi-level building. So our women are not going to the dining room. Staff is going up and picking up those meals and delivering them. They can eat up on this floor in our dining room because it's a little bit more isolated. And then we also have a supply of emergency food if and when that shelter, the staff that provides the meals closes. If somebody is seeking shelter, and honestly, we haven't had an opening since it was announced. I think people who are here are sort of wanting to hunker down and not leave. But we added some additional questions to assess health symptoms. So we would be looking for symptoms and exposure. If there's any sort of elevated risk, we are asking that she reach out to a professional healthcare, not go to the emergency room, but we even have some people from some local community clinics that we work with that are willing to do an advanced screening and monitor for symptoms if we have somebody coming into shelter. If she is positive at that point, we're still not saying we wouldn't bring her in. Even saying it out loud, it kind of makes my voice shake. It would be taken on a very case-by-case basis, but if she honestly has nowhere else to go, we're gonna have to do what we have to do. She would be in that quarantined room, and knowing that all this is very fluid. It could change at any moment. All residents who are in shelter and who have been in shelter for the last week are asked to do a wellness check every 12 hours. So what we're hoping for is 8 a.m. and 8 p.m. We are monitoring symptoms and asking them to take their temperature. So each family has their own thermometer that is clearly marked. We are using thermometer covers, we are disinfecting, but each family does have their own. And then if anything changes based on those, we are also at that time asking about where she has been that day. Just in general, I don't need exact addresses, but just if a hot spot would sort of pop up, we would at least know if any of our women had been to those areas. If anything would give us concern, we would reach out to those connections that we have at the community clinic. Again, if she's diagnosed, she would be quarantined. We would post a sign with no identifying information, and it would probably be easy to figure out that there is presence of a very contagious disease and recommended precautions. We are officially down to 1 staff member working per shift. If it is your scheduled shift and you are not physically at the shelter, you are answering phones. They are being forwarded to your house. That was one way that we thought we could still honestly and fairly pay people and say that they are still providing services and that we can still bill as such. Administration is sharing. We are on a different floor, so we are all here sort of 1 day a week, because we're doing what we can from home, but there's some things that some things that need 2 signatures. So one person signs and then they wait for the next person. We are preparing a schedule for staff with at least 2 weeks in advance and letting staff know, tomorrow may not be your day to work in shelter, but if anything changes and your partner has symptoms or your partner can't come in, you have to be available at the last minute's notice. We have one staff person who is already out of that rotation and can only work at home. I have her permission to share this, but she is on dialysis each night. So she is especially high risk and we've got to keep her safe. But she's doing whatever she can from home. Our communication has become extremely important. So myself or Michelle Rohde, the program director, is making contact with each shift within the first 30 minutes of them coming onto shift. We are sending a daily email that is going out about 3 o'clock so we can update the entire staff with any new changes to our procedures. And then we are sending out a weekly email to the entire domestic violence community, or more often if there's a significant change to our policies and procedures. Yesterday, we started meeting with women and asking for a plan B. If the shelter would unexpectedly close, or if we would no longer have staff healthy and well enough to run the shelter, what would your plan be? Most of our women, so like we're having to say things like, listen, you may not get along with your sister, and in a perfect situation, you don't want to live with her, but under these circumstances, can you? So far, all but 2 of our residents have come up with something. We've already reached out to a motel. We had to call several. A lot of them are not accepting new reservations, but I think, knock on wood, we figured out something. And then the other thing that I would suggest is documenting everything as you go. Not so much about for liability, which may be for that too, but like for us, I can't believe it's only Tuesday. Like I feel like it's already the end of the week. So, you think you're going to remember the steps of everything that happened, but if we ever needed it again, it would be helpful to know what we had done in the past. I think that's all I've got.
Thank you, Jessica. That was all really, really helpful. And I really appreciate the last thing that you mentioned about documentation, not only for our current needs, but in being able to plan for the future, and really being able to learn lessons from what we're doing now to apply for any future public health crisis, natural disaster that we may have.
Right.
So I've been keeping track of the questions coming in on the chat, and I'm gonna go ahead and scroll back up to the first one and make sure that we address it. And then if folks wanna continue either asking in the chat or putting your name up, then I can call on you. Some have been specific to presenters. Some I think are more general for any of them. And so what I'll do is actually invite any of our 4 panelists or Zach, Colleen, other coalition staff who are on the call to go ahead and unmute and answer as we go along. So the first one that came through was from Ngazi, and she asked, I believe this one was directed for Julie, are all staff members working remotely?
This is Julie. Can you hear me?
Yes.
Okay. Yes, all staff members are working remotely. We are taking turns coming into the office for certain activities. So to get mail, to check the fax, to see if we've gotten any subpoenas, things like that. Hopefully getting checks, issuing checks, responding to invoices, things like that. So we're coming in probably about the plan is 3 days a week to do those tasks. But otherwise, everybody's working from home.
And then a follow-up for you, Julie. There was another question about how are you paying for public health paid leave? Are you billing grants, or do you have other funds to pay for that?
Yes, we are planning on billing grants. We have not gotten approval yet. However, we are, in thinking through this, which is why we put a policy in place for public health and safety leave, so that we would have an approved agency policy on how to handle this. But much like our inclement weather policy, where if individuals are not able to come into the office, or we close the office because of ice, something like that, and employees have to stay home, that it's official agency leave, and there are requirements around that individuals have to meet, such as doing as much work from home, being available, and those types of things. No traveling out of the local area while you're on work at home leave. But I'd love to hear from Zach to see if DSS and DPSS, I would hope that they would approve that, because it's actually allowing survivors to get access to services that otherwise would not if we just had to close.
I agree, Julie. As of now, I just checked my email. I haven't gotten an update from everybody, from them yet. But we will definitely send out message when we do hear. And I think that there is a long history of similar situations where these types of things have been allowed, and clearly federal guidance is making it allowable. So I think that's the path that we're going to be able to go. But I will confirm and verify that.
Zach, one other question that I have for you is, during this time, we have instructed staff, if they're not working, so if they're not on the crisis line, if they're not responding to hospital advocacy or counseling calls, that they would be engaging in professional development trainings. And, there's the needing to get it pre-approved. I'm just wondering if they would be open to doing something retroactively, again, keeping people working, keeping people up to date on on trends and victim services, and improving their skills.
Yes, those things are allowable. I mean, that's type of activities that you can get covered. Around pre-approval, VOCA, DVSS, SVSS, those things are much easier, and so I would say go forth. It's not as difficult because you don't have as much of a clear line between direct services and administrative services that support direct services. Your STOP and SASP grants and SSVF grants, those tend to be a little bit more strict, and so I will add that in my conversations with them, with DPS. But there's a lot of direct service related materials that people can read or do webinars or online stuff that's completely allowable, and just as supervisors kind of provide them guidance on the type of things that are allowable under your grant, and professional development is allowed in all of those major sources.
Thank you.
And then Julie, there is one other question that was specific for you, and that was if you would be willing to share your technology confidentiality policy as well as your leave policy.
Sure.
So what, we'll talk about it at the end, but what I'll actually ask is, we're directing folks to share as much as possible on Basecamp. And so we can talk about that at the end, but wanted to make sure to ask if that would be okay. So thank you, Julie. So the next question is, can you offer the option to work from home to specific employees based on their job duties, or do you need to offer this option to all employees? Jessica, I think you talked a bit about this and how St. Martha's is addressing that, but I'm going to let this be open to all of our panelists and coalition staff as well. Do we still have Jessica on the line?
Well, I'll let you know that it's allowable underneath HR stuff and HR laws. It's allowable underneath grants. It's okay, but different job functions provide different types of accommodations. So if someone's job can be done remotely, it's fine and they can do 100% of their job that way. If some of it can't, you try to be creative in what they can do. But no, it can be different for each staff member.
Sorry, I was answering really well and then realized I was on mute and nobody could hear me. So we typically have 2 advocates on shift. So the way we're doing it now is one's providing direct services here, one's answering phones from home. What we're realizing is that as much as possible, we are really encouraging people to work from home, understanding that sometimes we have to meet up. Fortunately, there's a few of us that live close enough to each other. It can be like, I just dropped something on your porch. If you can sign it, I'll pick it up at the same time tomorrow, right? So getting creative. I mean, there are just some things that you have to be here. And one of my biggest concerns now is what's falling through the crack that we don't even have time to think about. And even if we did have time to think about it, I don't have time to worry about it or do anything about it right now because we're dealing with the here and now. So we're doing the best we can with what we have, encouraging people to do what they can from home, and understanding that it could change on a daily basis.
Yeah. So again, I think reiterating what you and Allison, Julie, and Marianne all mentioned of the importance of flexibility and just consistent communication among staff.
Matthew, I might add, this is Cheryl with the Coalition. While you can offer different types of flex, if you're talking about paid administrative leave, there's a lot of direction right now that is saying that if you're going to offer it to one, you need to offer it to all, that there can't be a discrepancy between who you're offering those types of benefits to.
Thank you, Cheryl. That's a really important consideration to keep in there too. So the next question is, I heard that a new bill passed that mandates employers to provide paid sick time to employees and to have children that have lost access to school or daycare as a result from the virus. Can anyone verify this? Jennifer, I know that you had sent me a quick message that you wouldn't mind addressing that one.
So just to clarify, so at the state level, the Missouri General Assembly and Senate.
You might need to speak up a bit, Jen.
Can you hear me okay now?
Still pretty faint.
Okay, I'm talking really loud. We're good?
Gotcha.
All right. So the legislation that Kelly is mentioning is at the federal level, and it has not been passed by Congress or sent to the president yet to be signed. So at this point, there is nothing definitive. There is a House bill, HR 6201, that's been sent to the Senate that addresses some paid time off, but it's specific to employees who are sick themselves or taking care of others. There were additional amendments that were proposed that didn't get added onto that, and so separate legislation is being filed today that would expand who all might be covered, but that's still going to be a day-by-day process to see what actually gets sent to President Trump and signed. There will most likely be something, but don't know yet how extensive it will be, and we will notify members of what does happen and what that means for your work.
Great, thank you, Jennifer. There was also just a quick comment that Jessica, I know that you had kind of discussed from St. Martha's perspective, but from Stephanie Logan that just an FYI, if there's a shared ventilation system with a room and the rest of the facility, it will not provide the necessary protection. And so just wanted to acknowledge Stephanie's comment and that Jessica, that was a consideration that you all had been thinking about?
Yeah, can you hear me?
Yes.
Okay. Yeah, I mean, at this point, it's, you know, we just keep thinking of it like any safety plan that we do with women. All we can do is minimize the risk at this point, and it's better than having them be out in the common rooms with everybody.
Yeah. So the next one, thank you, Jessica, and Stephanie. The next one was another kind of comment for everyone, but Megan from Genesis mentioned that they've had a telehealth program for over a year now, and that they have policy informed consent forms already developed. And so Megan put her contact information in the chat, but that's also something that, once again, we're encouraging people to share these resources with one another on our Basecamp. That way we're all connected. And the next one, which I think was directed towards Jessica, and I think you also kind of answered, is how do you handle meals for those who are isolated? So you had mentioned that primarily your staff were picking up and delivering meals to the rooms for residents.
Yes, so that's what we're doing. We are picking them up from the kitchen and delivering them. So not just to protect our women, but there's some other people in the building that are at high risk, so it protects them as well. And we're trying to keep that kitchen staff safe so they can keep providing meals through this whole thing too.
Yeah. So one other question that I think was mostly directed for you, Jessica, was about when you mentioned possibly posting a sign about someone having the virus. There was a question of where would you post that, and why would you do that? Who would need to see it?
So we have done that historically anytime there's an extremely contagious communicable disease. So we do not report the name, we do not report any identifying information. I mean, I'm not silly enough to think that people can't figure it out if somebody is also quarantined, because I think people, you know, right now we're living in a time where we're just assuming that we're going to be exposed to something because we're currently in a pandemic. But I think it's fair to let everybody who's living in the shelter know that there's a risk and what they can do to protect themselves. So we would post it. We've done different places. We have a community bulletin board. We could post it there or in another community area on our floor that they might see. Not like really, on the person's door that has it or anything. Yeah,
but more for staff and other residents to know, just
Correct.
As kind of that risk reduction internally that you were
Exactly.
speaking to earlier.
Exactly.
Thank you. So the next one looks like it's from Barb, and it was being concerned about food. Stores are low on products, and if it gets worse, what are programs going to be doing about food and making sure your programs have food on hand? So I'll open that up to Marianne, Jessica, Allison.
I mean, I can tell you, I don't know that I have a great answer right now because we can't make resources appear. And, you know, in the future, I will know that to make sure that we have plenty of emergency food. The one thing that works really well in our favor is that we get probably 85% of our donations that last us all year at Christmas time. So we might be hurting more in July than we will be right now. But right now we are fully stocked. I don't know that I have an answer on how to make that happen if you're not. I know our local school districts, when they closed, were working very hard and working extra hours on the buddy backpacks. So I don't, to send home with kids who they worry about being away from school for so long that may not have access to food. Our St. Vincent de Paul Society here has been encouraging people to call but that's the best I've got right now.
This is Allison. So just today, we couldn't buy milk, and it was quite a scramble. So food insecurity is going to grow.
Mm-hmm.
We did add food baskets as a service for clients now, since normally they can come in and eat at our facility whenever they need to, but now we're sending home for them to really keep, again, we're looking to keep people from the facility if they don't need to be here. So we're sending home and going to offer them weekly food baskets. But fresh items are problematic for us right now, like milk.
Mm-hmm.
Yeah.
One thing, oh, this is Mary Ann. One thing that we also got a notice from our food bank. So I think contacting them, and they were saying they wanted to help even agencies that didn't typically do food baskets. So we might want to contact those and see what they can do to help too for each of our shelters.
Another recommendation that we heard this morning was doing two things, trying to go right to the source. So making friends with the store manager, or find somebody who knows somebody who's willing to hold back a few gallons for you. There's also been talk of calling Prairie Farms, calling any of your local dairies that might be willing to hold some for you if they understand the situation.
Yeah. Well, and I appreciate all of those recommendations. Allison, to your point, yes, we already know that food insecurity is a problem for many in our communities, and it will continue to grow. And so absolutely talking with food banks and pantries, grocery stores, direct farms, if you can, those are really good ideas of getting creative with our advocacy. The next question is, are other shelters having counselors work remotely? And so are shelters trying to continue to offer your counseling services, but on a more remote basis? So Allison, I know that you spoke to that, but Jessica, Mary Ann, I know that Moxa, Julie, you'd mentioned y'all were trying that, so.
Well, our counselor's contracted, so I think she'll make that decision for me. But we will be limiting that because we're going to be not having our support groups anyway. It seems like we won't have a therapist in the building, at least for a few weeks till we find out what we should do.
Okay.
Yeah, so one of our advocates who works a normal shift is also the one that provides any sort of life coaching or brief counseling. She is still seeing people as needed, but very, very solution focused and short term, with the understanding, I mean, it's not ideal because she's the only person on shift. So it's really hard to block out even 30, 45 minutes for individual. But we have been in touch with some of the local hotline, like the life crisis hotlines and things like that. So we can at least point somebody in direction who are typically doing work over the phone on a good day to make sure that they are still able to receive those calls, and they are at this point, so.
All right, thank you. The next one I'm actually going to direct to Zach, and it is, where are the federal instructions for VOCA funds?
It's a guidance that came from OMB, so it's a policy memo, and I can send that out. Or you may not be able to Google it. I'll post it on Basecamp, but the specific memo that gives that guidance.
Okay, thank you. There was another question on if people could share their public health leave policy. And so yes, absolutely encouraging that people share those with one another on Basecamp and continue to connect with each other on these. The next question is, where can I find the Catholic Charities pandemic guidance?
Well, you know, that is one of the many perks of being a Catholic Charities agency, but I happy to post it on Basecamp for everybody to see. You might be able to Google it and find it, but I will share it when this call's over.
Thank you. So there was another comment for me to repeat what Cheryl said, and thank you, Cheryl, for going ahead and putting it in the chat. But that if you're going to offer paid administrative leave benefits to one employee, that there's a lot of direction out there that it's required to offer it to all your employees. So just making sure that it is something available to everyone on your staff. And then Cheryl following up to say, the other thing to think about is if you're offering telework options to one employee and there are others in similar positions, that they too should be offered that flex work. So another question is, what is everyone's opinion on clients coming and going from shelter during the day-to-day activities? So for our shelter folks, how are y'all handling residents coming in and out of the building?
So outside of that 12 hours when we sort of asked everything to be put on hold, we have not restricted anybody's movements. We have that conversation almost every day on at what point does it come to that. And we're sort of, you know, are being very transparent with the women who are currently living in shelter about why we are making the decisions we make, and we don't know what tomorrow looks like. Right now, we don't see the need to do it. I'm not saying it'll never happen, but that's another reason why we wanted people to sort of come up with that plan B, because if they get to a point where they can, and I understand why, I mean, I couldn't live by the rules that would be imposed in shelter, right? So, but if they understand that they can't and they feel like they need to have somewhere else to go, then they start thinking about that now, because it could happen quickly. It's one of the reasons why on that wellness check that we're doing, we include on the form, we're asking people, what are the geographical locations, at least, of St. Louis City and County that you've been to today? Because if that area does pop up as a hot spot, that would be another thing that we could monitor. But we have, you know, normally we are encouraging women to be out and about and job hunting and doing lots of things. We have told everybody not to worry about outdates, that we understand that this has definitely created another obstacle and might need.
Oh, I think you froze again, Jessica. All right, I think you're back, but you froze for a moment. So I'm also going to ask Allison and Mary Ann.
At this point, we're not limiting how many times they leave or where they go. Like Jessica, I'm hoping it doesn't come to that. And I understand you have to be out of this building. I don't know how anyone would live like that. I think we have to take that into consideration as well. Hope it doesn't come to that, but if it does, we will ask them to stay in the building.
And we are not limiting their ability to go where they need to go. But unlike St. Martha's, we are really pushing short turnarounds. I mean, we are really asking our women to identify any potential safer place, because to be honest, a group living situation is not particularly safe right now. So we are really looking to shorten residential lengths of stay.
I think we're doing both. It's not that we're telling everybody we want them, but so at the same time, we're also having a conversation about if there is somewhere else you can go, but if there's not, and you're worried that you're not going to be independent at the end of this, yeah. But yeah, group setting is not ideal at all.
Yeah. So Lori had a comment about food supply and saying it may not answer anyone's immediate need, but CASA always orders a whole hog and whole cow each year, and that typically meets their annual need for meat and protein. I also saw a comment come in about baby formula because baby formula was running low. And so Ashley commented, I'm not sure how true it is, but I have seen that if you call the number on the side of the formula can and explain you can't access anymore, that the company will send you some for free. I'm not sure how accurate that is. And so I don't want to necessarily recommend that everybody go and do that. But I do want to open that up to our panelists to say, for you all thinking about milk, baby formula, what are you finding in your community is working?
Well, that's why I was saying that we needed to really collaborate with our public health agency because they also have the WIC unit. And so if there are buddies, and because nobody gets enough formula every month through WIC, you are going to have to supplement that with food stamps or cash. And I think in a crisis at a shelter, you're going to get a lot of help from them if you partner with them.
Yeah, thank you for mentioning that, Mary Ann, and really connecting to the WIC program at the health department too. Another question that came through is, how is everyone who sees outreach client handling those outreach needs?
We are seeing our outreach numbers skyrocket. People, I think, are a little worried about access to food and things that they need. And so we're just trying to take one call at a time and meet those needs. But we are seeing that it's going to be another issue for us.
Yeah, we've increased our staffing just on our hotline just because we have really a lot of anxiety out there. So where we normally have during the business day 2 people on our hotline, we're adding a 3rd. And we are really actively seeking some new resources to give our staff. So just kind of responding to, okay, so now we're getting 18 calls about people's formula. Our staff have no idea what to tell them. So we have somebody else researching it and coming up with numbers and places that people can go. So we've really switched a lot of energy over to extra staffing there.
Another thing that I just thought of on the formula issue, besides the spare that you may be able to pick up at the health department, call your pediatrician's offices in your county because they always have samples. They've sent them in the past to us, and so they may have some that they would make available knowing that the people we serve are in special circumstances. It might
so to OBGYN offices.
Excellent. Thank you both for that suggestion. Yeah, pediatricians, OBGYNs as well. And there was a comment that Infamil has confirmed that that is just a rumor and that they are not giving out free formula. So I appreciate these really practical tips of talk to your WIC office, talk to your pediatricians, your OBGYNs. And again, reiterating that it is community partnerships and working alongside those folks in your community that we really need to focus on in the moment. There is another question, Jessica. Would you post your wellness checklist in Basecamp as well?
Oh, sure.
So seeing a lot of requests for us to start sharing documentation with one another. And then the final question that I saw come through, are you limiting rooms to one family or are you still sharing rooms between residents?
We always do one family per room. Sometimes if we have single women, we'll put single women together, but we are not currently doing that. So every family has their own room.
we don't have that luxury, so we are still putting more than one family in a room or several single women if that's what we need to do. I think we live in such close quarters and we have so many people in need. I don't know how we can keep people 6 feet apart. That's going to be my biggest concern, whether they're sleeping or eating or walking around the building.
We're moving towards the one person per room. So we pretty much always gave a family their own room, but not the individual women. But that's really where we're, again, part of our downsizing of our residential is really to try and minimize people being on top of one another and give the family one family per room.
Thank you. So it sounds like part of it is just looking at your shelter capacity. Are you able to offer it? And how are you kind of trying to mitigate that risk of people being too close at once? So we are now at 2:55. I haven't seen any other questions come through. So I just wanted to do kind of a quick wrap up. And the first thing that I wanted to mention is, once again, to really encourage the use of Basecamp. If you are not part of any of our Basecamp groups, please reach out to us on staff. We'll get you connected to those groups. In times like this where we are all kind of figuring out how to do our work remotely and support one another in it, Basecamp is a really great way for us to stay connected. And so Cheryl, while we were on this call, even created tags inside of Basecamp, and she had asked that we really encourage people to use those tags. So being able to do searches specific to those documents make it easier when you put a tag on things. Anything else that you would want to add just for tips about Basecamp, Cheryl?
Don't think so. I'm working on tagging the things that have already been uploaded. So you should be able to find those fairly soon.
Excellent. Thank you, Cheryl. And to that point, again, we've all been talking about how we really wanted to share in each other's policies and documents that we already have. We worked really hard on staff to cull down all the information coming out and put them on 3 different topic-specific resource sheets. Those are very much living documents, and we will continue to update those as we get information, but we certainly want to recognize that there is an abundance of information coming out. There's a lot of information on the internet, and we want to make sure that members have the most factual and pragmatic information that is practical for you. So one thing that we certainly recommend is to continue to look at CDC's website. They are updating it constantly, and so they're going to have the most up-to-date information. If you see something that seems like it might not be true on the internet, it's always best to verify, and so look where the source of information is coming from. If there's something skeptical about it, certainly reach out to Coalition staff, reach out to other folks on Basecamp. Your peers can help field those questions. The other thing that I wanted to mention is we are also working on setting up regional calls that will happen next week. And so myself, along with folks on our member services team, are going to be hosting regional calls that are just going to be an opportunity to hear from you all. What's happening in your community? How are things progressing? What are things that you think are really important for us to know about? As we are constantly talking with our other statewide partners, they are asking for that information. As we're doing our advocacy work with other state and national partners, we really need to hear from you all. What's happening in your program? What's happening in your community? And how do we make sure that we are advocating on behalf of you all at the state and national level? The last thing that I wanted to mention is just that this is going to be released this month in our newsletter. So after this recording is over, I'll upload it to our YouTube page. And that's an opportunity, yet again, for us to continue to share information with one another. So we are trying really hard to make sure that you all have the information you need. And we are working to be responsive to our members. And so just, again, wanting to say we're working through all of this together, but we are also working at the coalition to be clear and consistent and to get you the information that you need as we are receiving it as well. So I also want to open it up to other coalition staff, if there are other folks who have any kind of final words before we end the meeting.
I just want to say thank you to everyone. This is Colleen, and at the height of our community conversation today, we had 99 people joining in. So obviously that says to me that this is valuable, and we will keep doing this and bring you all together, hopefully on timely topics, things that we learn as we learn it, augmented by all of the information you're sharing on Basecamp. So until that point, thank you so much for your participation, and I'm just really, really grateful for all the work that you're doing, and for your supporting the staff members who are also working really hard in such unusual and demanding and often frightening circumstances to help those who are also living through those situations. So thank you very much, and stay tuned. We'll keep connected.
Absolutely. Thank you all.
Thank you.